Hello, thank you for the opportunity to speak at the Women's Cancer Conference today. My name is Jay Kim, and I'm a thoracic surgeon at City of Hope Cancer Center. I specialize in the surgical treatment of cancers in the chest, and today I'll be speaking mainly about lung cancer, which affects many women. By the end of this talk, I hope you'll have an understanding of the risk factors for lung cancer, what lung cancer screening is, and what treatment options are available for lung cancer. So we'll start with a little bit of a pop quiz. I'm just going to ask, what is the #1 cause of cancer death worldwide? And the answer, as you might expect from the title of this talk, is lung cancer. And similarly, in the United States, the #1 cause of cancer death is also lung cancer. But what you might not know is that the #1 cause of cancer death among women in the United States is also lung cancer. That's right. Lung cancer is something that is really important and underappreciated. Most people don't know that lung cancer is actually the #1 cause of cancer death among women in the United States. And people don't really think of it as a women's cancer, but it actually kills more women than any other cancer. This year, there will be close to 230,000 new cases of lung cancer in the United States. And there will be over 136,000 deaths from this cancer. In comparison to other cancers that affect women, lung cancer kills about as many women in this country as the next two cancers, that's breast and colon cancer, combined. It kills more women than colon cancer, than breast cancer, or pancreas cancer. And the thing about lung cancer is that it's not just among smokers. Although smoking is the biggest risk factor for lung cancer, many non-smokers get lung cancer as well. About 20% of lung cancers in women occur in women who have never smoked. Donna Summer and Valerie Harper are just two examples of women who died of lung cancer who never smoked. Lung cancer in non-smokers would be the 6th leading cause of cancer death in the United States. That's just among non-smokers. And if you look at the progress of lung cancer over the last 40 years, we see that one of the reasons that lung cancer kills so many people is because the survival rates have barely improved compared with other cancers. So we see prostate cancer, there's been a big improvement in survival over the last 40 years. Breast cancer, there's been a big improvement. Colon cancer, there's been a big improvement. But lung cancer, this bar has barely moved over the last 40 years. And one of the main reasons for that is a lack of screening. So, for prostate cancer, we have the PSA, which is a great screening tool. For breast cancer, we have the mammogram. And for colon cancer, we have colonoscopy. All these screening tests help us to detect cancers earlier, which is the key to improving cure rates. For lung cancer, we see that the more advanced stage of lung cancer, the stages 3 and 4, the survivals are really so much lower than the earlier stages, stage 1 and 2. The more advanced the stage, the less we have a chance of cure. And for lung cancer, most patients will present with either a very advanced stage or an intermediate stage. Very few lung cancers are presenting at the very early stage. But we do have a very effective screening test for lung cancer as well. And that is called a low-dose CT scan of the chest. This screening test was actually the first cancer screening study to demonstrate an improvement in overall survival for patients who were screened. The CT scan is much more effective than chest X-ray because it can detect cancers much earlier when they can be cured. Current guidelines recommend lung cancer screening with an annual low-dose CT scan for patients who are ages 55 to 80, have a greater than 30 pack year history of smoking. That means smoking a pack a day for 30 years or more, and are current smokers or quit within the last 15 years. Lung cancers that are caught early with a lung cancer screening CT have a greater than 90% chance of being cured. Unfortunately, the adoption of screening has been really low. Very few patients who are eligible for screening actually undergo a screening test. And many patients, and even lots of primary care doctors, are unaware or are unclear about the benefits of screening. So those are the guidelines for who should be screened in general. But for women in particular, there are some special considerations. So women seem to be more susceptible to the negative effects and the carcinogens of cigarette smoke. So if you compare a woman and a man who've smoked the same amount, the woman will be more likely to get lung cancer. And beyond the criteria that I outlined in the previous slide, the National Comprehensive Cancer Network has also identified additional risk factors that may make patients eligible for screening. And that would be exposure to secondhand smoke, a history of COPD or pulmonary fibrosis, previous history of cancer, a family history of lung cancer, and there are certain occupational or other exposures to harmful substances like asbestos, diesel fumes, coal, and chromium that would make patients more likely to get lung cancer as well. So what happens after lung cancer is found? Well, the answer today is very different than it was even just 5 or 10 years ago. Lung cancer has really entered the realm of precision medicine, where most of the treatments that we offer are much more precise than they were a few years ago. So from a surgical standpoint, I would say the surgery that we're offering today is extremely precise. The traditional way to treat lung cancer for a very long time has been through this big incision where we make an incision along the side and the back, and it requires spreading the ribs apart with these instruments that are sort of reminiscent of the jaws of life. And you can imagine patients tend to have a lot of pain after this type of operation and this type of incision, and there's a pretty long recovery process. But today, most lung cancers can actually be removed robotically. That's through a few small incisions placed between the ribs, where we use a video camera and small little robotic tools that can go through these small incisions. And at City of Hope, over 85% of lung cancer surgery is done in this way, robotically. And we have one of the largest experiences in the state of California. And the operation has an excellent track record here at City of Hope. It's extremely safe. So the chances of surviving the surgery and making it home alive are over 99%. And on average, our patients stay in the hospital about 2 days after the surgery, and many patients are able to go home after just an overnight stay. The advantages of doing the operation robotically are that there's decreased pain compared to the traditional approach. There's a faster recovery. Patients are able to go back to work sooner or resume their normal activities. Patients have to stay in the hospital for a shorter length of time, and they overall have an improved quality of life. And in terms of quality of life, it's also important to understand that patients who survive lung cancer can have many long-term health issues. Many patients with lung cancer already suffer from other smoking-related illnesses, such as heart disease or emphysema. And many patients with lung cancer will also develop a second cancer sometime in their lives. Sometimes it's a second lung cancer, but often it's a second other type of cancer. And so it's important for anybody who's had lung cancer to make sure they have regular cancer screening. And some of the treatments for lung cancer can cause long-term issues with breathlessness, feeling short of breath, chronic pain, or long-term fatigue. So precision therapy is certainly not limited to surgery. Advances in radiation treatment have made it much more effective and easier to tolerate than previously. Stereotactic radiation is a special type of radiation that is focused, high-dose radiation that can kill a lung cancer in just a few outpatient treatments. And the treatments can be completed often in less than 1 week. And because the radiation is so precise, it minimizes damage to surrounding organs and minimizes side effects. And finally, precision medicine really applies to advanced cancers as well. We do comprehensive molecular profiling of lung cancers, so we can detect all sorts of different mutations and other biomarkers that help us guide treatment. We use targeted therapies that attack the specific mutations in a cancer's DNA. And because these targeted therapies are specific to cancer, they have far fewer side effects than traditional chemotherapy and are much more effective. While not all lung cancers have a targetable mutation, you see many lung cancers do. And particularly in our patient population, we have found that many patients, because we see a higher percentage of patients who have never smoked, actually harbor one of these mutations that we have very specific drugs for. And women with lung cancer are more likely to harbor one of these targetable mutations. We also use immunotherapy, which helps the body's own immune system recognize the cancer as an enemy and fight the cancer. So in summary, lung cancer is the leading cause of cancer death among women in the United States. Most cases present late, but if it's detected early, the chances of cure for lung cancer are very high. If you have risk factors, you should request lung cancer screening from your doctor with a low-dose CT scan of the chest. If you do have a lung cancer, we now have precise therapies that can attack the cancer while helping preserve your quality of life. Thank you again.